important is early diagnosis of Lyme disease in preventing these symptoms from becoming a long-term problem? Like, can psychiatric symptoms improve with proper Lyme treatment?
Yeah, I mean, if the psychiatric symptoms are related to the infection, which is
Mhm.
most of what I see, they can 100% improve. Um,
Great.
and early diagnosis is probably the most important piece of all of this. I actually am starting to see people a lot earlier because I'm kind of connected with therapists and I'm connected with psychologists who do like neuropsychiatric evaluations, for example. And once other mental health providers are able to identify that this doesn't seem like a so-called typical psychiatric presentation, I've been seeing these kids a lot earlier, and it's so rewarding because we can make the diagnosis, like as a team, we can make the diagnosis much faster, and it's a world of difference. A kid getting diagnosed within a few months, even of the infection, or within a few months of the presentation of the infection, one of the complicated things about these infections is that they always don't present right when the person is getting infected. These infections can really be latent and very stealthy for long periods of time and then all of a sudden emerge out of the blue. But when we can identify what's going on within the first few months, it's like a game changer compared to someone who's been sick for many, many months because typically they just continue to develop worsening symptoms. It's much harder to treat when you're like a year or two into this process versus like a couple of months in.
Yes, I can tell you from personal experience what you're saying is absolutely correct.